You need a spine surgery. This statement from your surgeon makes a lot of patients to miss a heartbeat. Rightly so. Spine surgery is very commonly advised these days. But be informed that only a small, maybe a 5% of all patients with back pain eventually need to undergo a surgery. Most patients are cured with medications, exercises, physical therapy, and posture correction. Then, how to make sure that you need a spine surgery to correct your back pain? What if you don't need one? What if you develop a nasty complication after your spine surgery? Friends, being in spine surgery practice for 20 years now and being trained tens of young spine surgeons from all over the world, I'm sure I can help you understand your spine surgery concerns and help you make a decision. I'll give you 10 most valuable questions to ask in this video before you decide for spine surgery. Stay till the end, friends. I'll give you some excellent time-tested tips to choose your spine surgeon. Hello and welcome. This is Dr. Arun Naik from Doclogues channel, helping you to take control of your health and be on the positive side of your health. In this channel, we have dialogues on brain and heart health, lifestyle diseases, cancer, spine health, and preventive health. If you are new to the channel, consider subscribing to Doclogues. All the additional links, tips, and tricks told in this video, I will leave the details in the description box below. If you want, you can check those out. Back pain is the top reason for a doctor's visit at any point of time. I see at least 5 new patients every day with spine issues. Understandably, having a spine surgery makes many people feel scared, anxious, and nervous. If you are advised to have spine surgery, I advise you to do detailed study of your condition. Take a piece of paper and scribble these bullet points before going for a doctor's visit to plan your surgery. I want to draw your attention to one important study published in a journal called PLOS in 2017. The link is in the description box below. This study surveyed more than 2,000 US physicians and asked them how much medical care in their specialty wasn't actually needed. The study included all medical specialties. The respondents estimated that about 11% of all procedures performed in the US were really unnecessary. You heard it right. 1 in 10 procedures done in the US could have been avoided, friends. That's a big number. That makes all the sense to make sure you don't really need a surgery to relieve your back problem. What is the question number 1? Question number 1, why do I need a spine surgery? Friends, again I'm saying only 5% of patients need to undergo spine surgery. The remaining 95% will get relief with medications, physical therapy, posture correction, etc. Find out the need for the surgery and how it relates to the diagnosis of your specific spinal condition. Ask a direct question to your surgeon why he thinks that you need a surgery and why not wait to try non-surgical options. Let's take question number 2. Are alternate treatment modalities to spine surgery? In my practice spanning 2 decades, for most spinal conditions, I consider surgery only after conservative or non-surgical treatments have been tried. I give them medications for a few months, physiotherapy for a few days, and try to reduce their pain. I'll also give them postural advice and teach them spinal exercises. Only when you are on all these modalities, we say we have tried everything. Please consider you come under the other 95% where your pain disappears completely without any surgical procedures. That takes me to question number 3. What will happen if I don't have back surgery? After you have been told about the need for a spinal surgery, the next question you should ask your surgeon is, what could happen if you chose not to have the recommended spine surgery? Will your spinal disease progressively worsen? How could not having a back surgery increase your pain? Please go ahead and ask this question. Question number 4. How long can you wait before going for surgery? Spine surgery is not that simple, friends. After the surgery, you may have to take a few days or weeks of rest depending on the type of surgery. You also will be working from home for about 30 days. I don't advise to travel for work for a month after some spine surgery and 3 months after a spine fusion surgery. This means you need to take leave for a month. If you have health insurance, it's okay. Otherwise, you need to arrange for funds for surgery, isn't it? So you may need some more time to decide regarding surgery. Every spine surgeon should consider these things in the best interest of his or her patient's good recovery. Let's go to question number 5. What surgery are you planning on me? Remember, there are many different types of surgery. Surgery is evolving, and every year many new techniques are coming, and different surgeons do different surgeries. For the same spine problem, my surgical procedure may be entirely different from another surgeon's. The backbone may be operated from the front, from the side, or from the back. Each of these techniques have different set of benefits and complications. Ask your surgeon to explain the procedure on a spine model so that it is easier for you to understand and decide. Also, ask him how many spinal levels is he planning to operate on. Ask him if he is planning to do a fusion procedure in addition to your main procedure, and if so, what type of implant is being used, whether it is a metallic, polymeric, alloy, etc. Ask if you will need a bone graft. Let's go to question number 6. How big the scar will be? These days, the size of the incision or the wound or a scar is becoming smaller and smaller. Bigger incision doesn't mean it's a major surgery, and a smaller incision doesn't mean it's a minor surgery as well. Most of my procedures these days are minimally invasive surgeries, meaning you will have a keyhole-sized scars. Make sure you exactly know where exactly the scar will be on your back and how big it will be. I take a marker pen and mark the scar exactly as it would be so that my patients can go home, stand in front of a mirror and check it out. Let's go to question number 7. What are my chances of pain relief after spine surgery? Ask a direct question, friends. What's my chance of a good recovery? Will all my pain and numbness go after surgery, or are there any chances of some issues recurring after surgery? What are the symptoms which get better and which are the symptoms not going to improve? As a patient, you have every right to ask your surgeon what you will gain from the surgery which you did not gain from non-surgical modalities. Why your surgeon thinks that you will be benefited. Also, ask the surgeon whether these benefits are short-lived or the benefits last lifelong. Friends, let's go to question number 8. What are the complications of the proposed spine surgery? Let me tell you, no surgery is safe in an absolute sense. All surgeries carry potential risk of complications such as infection, brain fluid leakage, excessive bleeding, risks of anesthesia, and nerve or spinal cord injury. Be sure you understand all the possible complications before you put your signature for the spine surgery. And if these complications develop, how these will be managed. Luckily, most complications can be dealt with easily. Friends, let's go to question number 9. What is your experience in performing surgery like this? This is, friends, a direct question often thrown at me, even at this stage of my career, by my patients. And I don't get offended by that. In fact, I feel happy that they ask that question. That gives an opportunity for me to explain my expertise in the field of spine surgery. I may show them a small video of my surgery to make them understand the process. Never hesitate to fire this important question, my friends. Choose a surgeon who performs the exact surgery you need and performs it all the time. I am a neurosurgeon, alright. That doesn't mean that I perform every surgical procedure on brain and spine. There are a few procedures I don't perform, and I am open to that, and I tell my patient to go to a surgeon who does that surgery routinely better than me. Practice makes perfect when it comes to surgery. Let's go to the last question. Do I need a spine surgery? Well, this question is to be asked to yourself. The most important question will be this one, friends, because it's your pain, it's your back, and it's your surgery. No one can take this decision but yourself. Pain is highly subjective. My severe pain may be moderate pain for you. You take your time. If the surgery is not an emergency, then I'll tell all my patients to take a week of time to decide surgery. Go back to your early days of pain and analyze your journey of pain. Take into account your severity of pain effect on your personal life, social life, and professional life. Count the number of days you were really sick and unable to go to your work. If you can count 15 days of such severe unbearable pain in the last 1 year, well, I'm afraid you are well going towards the decision for surgery. Friends, as I promised in the intro, now the most difficult part of this video. How to choose your spine surgeon. Friends, how did you choose your life partner, your career, or your job? How did you choose your new apartment or your new car? Difficult, isn't it? If it's an emergency indication for your spine surgery, then you do not have much options other than going for surgery. If the surgery is a planned elective procedure, then you have a lot of time to decide. Number one, go by reliable reference. Maybe your friends, relatives, or colleagues. That will be a good starting point in choosing your surgeon. Number two, do some research on your surgeon and hospital. These days, you can easily get enough and more info on your doctors online. Not all reviews are genuine. Be careful. Number three, go to your country's medical doctors association, college, or council and verify the credentials and privileges of your surgeon. Find out if your surgeon ever had a complaint with the authorities in the past. If yes, what was the outcome in such cases? Find out if your surgeon's license or privileges have been taken out anytime. One more place to verify your surgeon's past malpractice suits, if any, with your malpractice directory or legal database. If you find any instances of too many malpractice cases against your surgeon, it's prudent to stay away and look out for an alternate surgeon. Number four, contact your primary care physician and take a directive on your surgeon. He or she would definitely give you some insights into your decision and the way ahead. Number five, visit another spine surgeon. Comparison is easy when you have options. You compare your surgeons with regard to their approach, attitude, and communication. You will know the difference between your first and the second surgeons now. Number six, last but not the least, go with your intuitions. What was his attitude, his concern, and his body language? I am sure you will definitely have some clues to what is in store for you. If you're not satisfied your surgeon's explanation, attitude, or communication, change your course. With that, friends, we have come to the end of this video. Hope you found this video helpful. If you liked it, give me a big thumbs up. Share this video with your near and dear ones to put them also on the positive side of their health. If you are new here, please consider subscribing to Doclogues. Hit that bell icon to get instant notifications of my new videos. Friends, which one of these questions I mentioned was your favorite today? Do you have a question of your own? Did any of your colleagues or relatives undergo spine surgery? What was the process of taking decision and how did you choose your surgeon? Let's know in the comment section below. It will be helpful for hundreds of patients waiting to undergo spine surgery. I'll be back with another interesting doclog very soon. Friends, till then, feel awesome, live awesome, and take good care of your health.